The U.S. Preventive Services Task Force released a revised recommendation that states most adults should not take aspirin to prevent first heart attacks or strokes. Dr. Quinn Pack, a preventative cardiologist at Bay State Medical Center, joins us now with more on this shifting advice. Hello, Dr. Pack.
Hello, good morning.
Dr. Pack, this new recommendation upends a lot of medical advice that we've heard in the past, which is people that over 50 should take a low-dose aspirin to prevent heart attacks and strokes. What's the reasoning behind this change?
Yeah, so this is the real reason is progressive science. So over the last 5 years, there's been at least a half dozen really high quality studies that show that aspirin is really not giving us the strong protective benefit that we thought. Part of it also has to do with that our preventive therapies are better than they used to be. So cholesterol medicine, statins, are widely used. And when you're taking a cholesterol medicine, the need for an aspirin is less. And then I think finally, the side effects of aspirin are becoming more clearly recognized, that it doesn't just include gastrointestinal bleeding in the stomach or in the intestines, but on rare occasions, bleeding in the head or in the brain that can really cause some damage. So when you look at the risk-benefit ratio, we're pretty much at the point where unless you've got a good reason to take aspirin, you really shouldn't be taking aspirin. You'd need a good reason, and there are a lot of people who do need a good reason, but the average person should not be taking aspirin for preventing heart attack.
Dr. Pack, does the aspirin cause or does it exacerbate bleeding?
Yes and yes. So aspirin by itself can cause loss in the intestinal linings and ulcers in the stomach. It also makes the platelets more likely to bleed into the brain. So if you were to get a head injury and you were taking aspirin, you'd be more likely to get a brain bleed. Now, for all the people who take aspirin, this is a very small effect. So, you know, we're talking about one hospital admission out of 100 people over the course of a year. So it's fairly small, but it's noticeable. That's one of the reasons why the science had to advance for us to be able to really detect some of the potential harms.
Dr. Pack, they say in the study that people 60 or older specifically should stop taking aspirin. Why that age group?
Yeah, so this is, again, part of this risk balance. As you get older, your risk for bleeding goes up. The lining of the stomach and the intestines just gets a little bit weaker. So as you age, your risk for bleeding goes up. Now, it's also true that as you age, your risk for heart attack goes up. But as they've looked at this balance of benefits and risks, the United States Preventive Service Task Force no longer recommending aspirin for primary prevention.
So if you are a generally healthy person, aspirin is now unnecessary?
Yes, I would endorse that. Unless you have a specific reason to be on aspirin, you should not be taking it. Now, I want to be very, very clear about one point. Patients who have had a heart attack, who've had a stroke, who've had a stent, who've had bypass surgery, or who've had a blocked artery in the neck or the leg should still take aspirin. Please do not stop taking your aspirin if you've had any of those conditions. Aspirin is still effective for people who have established vascular disease. And we think that the benefits outweigh the risk in those groups.
Dr. Pack, you mentioned before that the preventative measures have become so advanced that there's a reason to drop aspirin. What other preventative measures should you speak to your doctor about?
Yeah, so I mean, again, right back in the 1970s when we were first learning about aspirin, 30%, 40% of people smoked. Well, we're down to 15%, or 12% in Massachusetts. So we continue to make progress on smoking cessation. If you smoke, you should quit. We also have gotten rid of a lot of the trans fats in our diets, and so overall risk has decreased at least a little bit. People are also using cholesterol medicines more and more frequently, and that actually really treats the disease, so that when you look at physical activity, blood pressure control, exercise, cholesterol, diabetes, the aspirin is not as important as it used to be. Again, still useful in some circumstances, but for the general population, it's no longer recommended.
So, Dr. Pack, bottom line, is it important to consult with your doctor about starting an aspirin regimen?
Absolutely. So the United States Preventive Services Task Force says that for people age 40 to 59, if you have an elevated cardiovascular risk, i.e. more than about 10%, and your doctors can help you calculate that. If you have more than a 10% risk, aspirin may still be reasonable. So if your doctor has told you to use an aspirin to prevent a heart attack or to prevent a first heart attack, then it's reasonable to continue to do it. But if you're otherwise healthy, I would not think that aspirin is going to benefit you in the long run. You do better to get your blood pressure controlled, your cholesterol checked, and treated if needed.
Dr. Quinn Pack from Bay State Medical Center, thank you so much for joining me to clear up these new recommendations. I appreciate it.
Sure, my pleasure. Glad to be here.